to my YouTube channel. Thank you very much. If this is the first time you are visiting my YouTube channel, please don't forget to subscribe and also hit the notification button for the future videos. Guys, I'm doing the review on this news today, which is another 717 coronavirus patients have died in UK hospitals, taking the nationwide total to 11,329. So that's a big number again. Today is 717. I believe is a Monday bank holiday. So these figures are not correct, I believe, because this is the like an estimated figure, and maybe they did not get the numbers from everywhere because it doesn't seem very because we know it's a bank holiday, so not every department is working today. So if you look at the numbers there, it is the lowest increase recorded over the bank holiday weekend, after 980 on Friday, which surpassed the worst confirmed daily totals in Italy and Spain, 917 on Saturday and 737 on Sunday. So that's a big number. I remember when I was watching news a couple of days ago, one of the Italian doctor, he clearly said to one of the Sky News channel representative that, you know, these numbers are coming to you and you better be prepared for it. And this is exactly what it is, 980. We're looking at the peak right now. The number of people who have been tested for COVID-19, the disease caused by coronavirus, rose to 290,720, following another 15,506 tests on Monday. So we're looking at the test numbers. The government is not doing enough to do the more tests. They were talking about 2,500, then they're talking about 10,000, then they said 25,000 a day, and then they said, oh, we're going to do 100,000 tests a day. I'm afraid we are nowhere near that. These are just numbers that they keep giving just to relax things at the moment, because when Germany were doing 70,000 tests a day, these guys just do a blunder saying, oh, we do 100,000 tests a day. They're nowhere near, and I don't think it's possible either, because they reacted very late, in my opinion. So the number of people who have been tested for COVID-19, like I said, you know, they said 15,506. So with the total 88,821 having now tested positive in the UK. So the figures were announced by the Department of Health. So, I mean, ideally, if you look at these numbers, are quite big, a significant increase in the amount of daily figures, the death rates we're looking at. NHS England announced another 667 coronavirus patients had died in hospital in England, taking the total in the country to 10,261. Of those latest deaths, 118 occurred on the 12th of April, while 537 took place between 1st of April and 11th of April. So it's a bit of up and down figures, Timmy. And again, the one thing we're lacking right now in UK is the testing. The testing is not on that level. They are not doing the test what they should be doing, because the numbers are very low. We're looking about, you know, I don't think the government is even touching 25,000 tests a day. They hardly, I mean, I think they hardly get into that number. 100,000 is a big you know, task, I believe, and I don't think so. They're going to be anywhere near that, and I'm not sure what's going on. And you know, these numbers are scary. We're looking at 980, 917, and today, you know, even these numbers are 717 today, and I believe the numbers, this could be even more, because these are the people who are died in hospitals. We're not talking about the care homes or people who are dying in the community, and those numbers are not even being taken. These are purely from the hospital, and it's scary. It's very scary, and I don't know where we're going with this, because you know, it doesn't look really positive at the moment. You know, we always being told that, yeah, we're led by the science, we are making the right decisions. But I always say that science is all based on experiments, and if experiments go wrong, it's going to be a disaster. That's what I would say. So not heavily relying on experiments. Please do something about it. You know, do more action. Don't just look at the science guide. We were told people with the underlying health conditions that, you know, are more at risk, but then we've seen the figures where people, healthy, young, fit people, have also died because of this virus, and there are many more people who are thinking they're invincible, and they're going out and they might catch the virus, and what's going to happen after that? It's very scary, and it's one of those things. I hope something will happen, in terms of making a vaccine. So hopefully we can overcome this disaster. This is terrible, terrible virus. Let's hope, guys, that we will come out with something. Thank you very much. See you next time.